I'm Nicole Johnson for DLife.com. To manage my type 1 diabetes, I take insulin. While I am currently using an insulin pump to administer my insulin doses, I took injections also for many years. Learning to take or administer an injection can be a challenge, but if you take the time to master the steps, it can be virtually painless. Before you administer any insulin doses, you should know what your blood sugar level is. It is important to note that insulin is a hormone that lowers your blood sugar, so taking too much insulin could cause a low blood sugar reaction. On the other hand, not taking enough insulin when your blood sugar is high could contribute to long-term complications. It is important to make sure you are taking the right amount. Talk with your doctor to decide what works best for you. When you're ready to take your injection, make sure you have everything you need: the insulin bottle, a U100 syringe, alcohol swabs, and a puncture-proof sharps container for the used syringe. Also, make sure your hands are clean to help prevent any infection. Wipe the top of the bottle with an alcohol swab. Check to make sure the insulin isn't expired and do a quick visual check of the insulin. Rapid and short-acting insulins should always look clear. Intermediate and long-acting insulins should look cloudy with no clumps or crystals. If your insulin doesn't look right, throw it out and start a new bottle. If you're taking intermediate or long-acting insulin, roll the insulin vial between your hands to mix it evenly. Don't shake, as this can make the insulin clump together. Rapid or short-acting insulin, clear insulin, does not need to be mixed. If your treatment calls for a combination of insulins, your doctor or diabetes educator can explain how to mix different insulin types into the same syringe. The marks on the barrel of the syringe denote units for measuring insulin. Each mark can represent anywhere from a half of a unit to 2 units of insulin, depending on the size of the syringe. So check the packaging to ensure you're measuring properly. First, you'll need to pressurize the insulin bottle by injecting air. Uncap the syringe and pull back on the plunger until the syringe is filled with air. If you are taking 5 units of insulin, you'll push 5 units of air into the bottle to keep it properly pressurized. Poke the syringe tip into the rubber top of the bottle and push down the plunger, sending the air into the bottle. Keep the needle in the bottle. Turn the insulin bottle upside down with the syringe still poking into it and pull back the plunger to your desired insulin amount. Make sure that the top of the black rubber stopper is even with the line showing your dose. Also, check for air bubbles inside the syringe. If you see one, tap on the side of the syringe until the air bubble goes to the top of the needle, then push it gently back into the bottle. Once you're ready, you'll need to choose an injection site. Most people use the back of their arms, their thighs, the back of their hip, or their abdomen. It's important to rotate these sites to avoid creating fat deposits that can delay the absorption of insulin. Once you've chosen a site, clean it with an alcohol swab and let it air dry. Then pinch up the skin and insert the needle with a quick stab at a 90-degree angle. Once the needle is in, release your skin and then push down the plunger, sending the insulin into your skin. After the plunger is fully deployed, pull the needle out and dispose of it in a puncture-proof sharps container. Many insulins and insulin mixes are available in pre-filled, pre-measured pen devices that can make administering insulin more convenient. If you're interested in using an insulin pen, talk to your doctor about your options. For more information on insulin and diabetes health, visit DLife.com.